Hi, I'm Lieu from the University of Colorado. I'm a GI medical oncologist. So how can my doctor be certain that I have hepatocellular carcinoma or HCC if they never did a biopsy? So hepatocellular carcinoma, or again, HCC, is the most common type of primary liver cancer. So liver cancer incidence has actually more than tripled since 1980, and the rate actually continued to increase by more than 2% per year in women, but it actually has stabilized over the last several years in men. When you look at the risk factors for liver cancer, it includes anything that causes long-term inflammation and scarring in the liver. And the most common agents that do this in the United States are hepatitis B, hepatitis C, and heavy alcohol intake. Interestingly, we'll see what the incidence of liver cancer is in the United States as more and more people get treated with more effective agents to treat hepatitis C. And interestingly, approximately 70% of liver cancer cases in the United States could actually potentially be prevented through the elimination of risk factors such as obesity, diabetes, hepatitis B infection, or just reducing alcohol intake and or smoking. One interesting fact is that there's some evidence that's emerging that shows that drinking coffee may actually reduce your risk for liver cancer. So as you go to Starbucks, keep that in mind. Patients that have cirrhosis, which is a late stage of scarring of the liver that can be caused by some of the risk factors that we just talked about, we actually may screen patients that have liver cirrhosis with screening ultrasounds. And what we're looking for on those ultrasounds are really any masses that would be concerning for possible cancer. If an ultrasound is done, which is a fairly easy radiologic test, if there's a concerning area, then we would then want to order a better imaging test, such as a CT scan or an MRI, and this gives us a better look at the liver. When we think about cancer, we often think about needing a biopsy, or in other words, a tissue diagnosis. And this usually involves a needle going into a mass that we're concerned could be a tumor, or even a surgical procedure sometimes, just to get a piece of that tissue to look at it under a microscope. And that's how we confirm a diagnosis of cancer or not cancer. And this is how most cancers are diagnosed. However, with liver cancer, a biopsy is not always needed. Most of the liver gets its blood supply from the venous system, and that's just kind of the way our bodies were designed. This is the system that returns blood back to the heart. What makes liver cancer different than the normal liver is that it has a tremendous arterial supply. So on a CT scan, the classic feature of a liver cancer is one that lights up bright on the arterial phase of a CT scan. And this is the picture that's taken by the CT scan as the IV contrast that is injected into the body. As it goes through the body's arteries, a picture is taken, and we call that the arterial phase. And a classic feature of liver cancer is that that contrast washes out or is completely gone during the venous phase of the CT scan, or when the picture is taken as the IV contrast goes through the body's veins. So that classic appearance is that arterial kind of light up with that venous washout. So with this classic appearance on radiographic imaging, many times a biopsy is not needed to establish a diagnosis of liver cancer. And this is important because it prevents doctors from having to order an invasive test that their patient does not need. But almost more importantly, there are rare cases where a needle biopsy can actually implant additional tumors along the needle tract where the needle is inserted into the body to get the biopsy. We call this needle tract implantation. And when this happens, the needle actually tracks tumor cells to different areas in the liver and sometimes even the skin surface. And cancer starts to show up where no cancer existed before. Besides causing spread of the tumor, it can also take somebody off the liver transplant list when you have needle tract implantation. So it is important to avoid this if at all possible. Again, needle tract implantation is a rare event, but even if it happens in one patient, it's one patient too many. We should note that not all liver cancers can be diagnosed with CT or MRI imaging alone. So sometimes when the picture isn't classic for hepatocellular carcinoma, sometimes a biopsy has to be performed to establish the diagnosis. Having said that, it is important to ask your doctor if you indeed do need a biopsy or if a biopsy can be avoided. And a lot of times this decision is made in a group, not by a single physician, but actually a multidisciplinary tumor board where doctors come together, review the imaging, and can determine and tell you whether a biopsy is actually needed.